Hello everyone, this is John Lynn from EMRandHIPAA.com, part of the HealthcareScene.com blog network. This is some of my first videos, so we're going to give it a whirl. We're going to start off with some question and answers. I'll probably chop them up into each individual video. I'll do one video per question, I'll stop the recording and start again. So, we're going to start with the first question that comes from Twitter from HW Integrator. So it's at HW Integrator, Sean Myers, and he asked the question, how will healthcare IT save on Medicare costs? That's a pretty loaded question, and it's pretty complicated to think about, but I think the best place to start to answer this question really has to do with the EMR stimulus money. So the HITECH Act, in the budgetary process, the CBO projected that the HITECH Act would cost essentially $18 billion, and a few other numbers were thrown around, but it's somewhere in the range of $18 billion of savings that they would get from the HITECH Act, the implementation of electronic medical records, and I think it also included some of the HIE components and the exchange components. And the way they looked at it was that they essentially estimated there would be $36 billion of spending total, and then there would be savings all the way down so that the net cost to the government would be $18 billion. So you can do the math, 36 minus 18, right? So it's $18 billion of savings that they would receive from the implementation of electronic medical records and other parts of the HITECH Act. Now, where they got those numbers is a little beyond me. So I think we can find some reasons that they could save money. Potentially they could save money from electronic exchange, although they were already really doing that. So where else would they save costs? Maybe through duplicate tests that were done on Medicare. Maybe they could decrease Medicare fraud. There's potentially some savings there if they have the information and the data that could come from an electronic medical record system that's uploaded to them. They could potentially save on Medicare costs by decreasing Medicare fraud. Otherwise, I'm not sure where they're getting the savings. Is there logistical savings that they could save? Honestly, I really don't know. But what I do know is that there is the benefit of an electronic medical record, and by having the data you could find the Medicare fraud, amongst other things. Could you improve the health of a patient? Are they evaluating that? I'm not sure how they come up with a number though that says, okay, well, we're going to save $5 billion in Medicare fraud because we have the extra data, and we are going to save $10 billion on other tests that wouldn't be done otherwise, or through improved healthcare because of the meaningful use and electronic medical record. That seems like a little bit funky math to me, but I think that's where they were going with the savings. Maybe there's other things that people that might know of, but to me it's a little bit of a slippery slope to say that there's a lot of savings to Medicare because of it. Although the one thing that is true is that the data is really valuable. So the more data they have, the better they can administer the program, and the better they administer the program, they could have savings. Now, how the CBO office came up with $36 billion of EHR spending and $18 billion of savings, with the net of $18 billion of stimulus money being spent by the government, that seems like some funky math to me.